Meg Harrell, or Nurse Meg as she is known on social media, is a veteran of the industry and nurse educator. She says the convenient insurance plan you get through work might not be the most cost effective.
It is similar to shopping around for car insurance or home insurance or things like that. Thanks to the internet, we can essentially live the entire human experience online. So it's the same way. You really need to go out there, look for different providers and compare the prices and the coverage that they provide. Yes, it's not always about money and how much is coming out of your wallet. Of course, you want to compare the prices and the plans, but you also want to customize it to your needs. So some people will need more coverage than others. If you are seeing the doctor often, or if you take a monthly prescription, you're going to need to customize that to find the plan that's specific for your needs.
Now, when it comes to the best health care coverage, Nurse Meg says there is a list of words to keep in mind.
Yes, there are 7 terms that you need to know and understand before you're shopping around. And don't be intimidated. They're very simply explained. So number 1 is premium. A premium is the amount of money that you pay to the insurance for your monthly coverage or yearly coverage or quarterly. So this is how much comes out of your wallet each month to pay the insurance to sort of like be part of the club. It's your monthly dues. Now, deductible is the amount that you pay for your medical care, for your doctor's visit before the insurance comes and gets involved and pay. So it's how much comes out of your wallet before insurance comes by and says, I'll help you pay. And then a copayment is just that little flat fee that you pay to get a service or to see a doctor. Coinsurance is the percentage that you pay until your deductible is met. So usually it's like a 70-30 plan. So you'll pay 30% and then the insurance will pay 70% until you reach that deductible. And then insurance says, okay, we'll take care of everything from now on. And the out-of-pocket maximum is the max amount of money that you can pay for medical services in 1 year. So this combines your copay, it combines your deductible, your coinsurance, and there is that max that says, okay, that's enough. That's crazy. That's enough paying. Now insurance will pay. Pre-existing condition is any disease or diagnosis or disability or any imperfection in your health that insurance can use to deny you coverage or access. And a really quick clarification, Medicare versus Medicaid. Medicare is government-funded health insurance for individuals with disabilities or over the age of 65. And then Medicaid is a combination of federal and state for low-income individuals.
A higher deductible is one way to save on health insurance, but that's not all.
I love an HSA plan, which is a health savings account. Now, this is a tax deductible account where you can put money into this account and only use it for healthcare services. It could be for seeing a doctor, it could be for buying a Band-Aid, it could be for paying prescriptions, and it's a really good way to save on medical expenses.
Nurse Meg says for an individual who doesn't need a lot of medical care, they can get a low monthly rate of around $100, and that is with a higher deductible.